Thank you for reconvening, and we're gonna continue. And right now we'll welcome in Dr. Joanna Katzman from the University of New Mexico. She's the director of UNM Eco Climate Change, and so it's an honor and privilege to have her to join us and talk about the project, that eco project that is one of our flagship projects here at the university in terms of intersectoral collaboration. So with that, thank you so much, Joanna.
Hi everyone. My name is Joanna Katzman. I'm a neurologist and actually pain management physician at the University of New Mexico. And I've been here at UNM here in Albuquerque for over 25 years. And I'm going to share my screen now that I'm unmuted, and I'm going to tell you a little bit about how I got involved in climate change, and then share a little bit about the climate change and human health eco project that I started about 3.5 years ago. I got involved in climate change. I started out as a neurologist doing pain management and doing a lot of public health education regarding chronic pain, and the opiate crisis in New Mexico has been just terrible in the United States. New Mexico has really led the United States in heroin overdose deaths and drug overdose deaths really in the last 20 years. It's really not a great statistic to talk about, but because of the public health crisis of both chronic pain and drug overdose deaths, it's education that I've been able to lead through an organization called Project ECHO, which is a telementoring organization based out of the University of New Mexico. So it's very similar to what we're all doing here now, meaning that clinicians and health professionals and educators get together on a virtual platform, such as, for instance, you all as students and faculty in the classroom where you are, you meet and you maybe you are let's say you are the experts. Let's pretend you're all the experts and you're talking about climate change, and you're reaching out to people all over the United States and all over South America, and you're reaching out to all the people who are in these Zoom boxes. Well, that's what Project ECHO is. It used to stand for Extension for Community Health Outcomes, and now we just really use the acronym to really mean ECHO, meaning that we're echoing the information because we share best practices. We have a network of people that we give information to, and we share, and we collaborate on the information, and it's capacity building. So the information that I might learn from all of you, you're going to share to your colleagues, and you might, as you go on and you become doctors and lawyers and educators, you are going to teach what you learned on the network. I got involved in the climate change ECHO because our Rio Grande River, even when we're not, even in months when the Rio Grande River is not normally dry, it is still drying up because of the extreme drought that we've had here in the southwestern part of the United States over the last 20 years. So I have lived very close to Veronica Plaza, and our kids have grown up together. And I think what Veronica and I have seen is that in the Bosque, the Rio Grande, which goes from, Colorado all the way down into Texas and to Mexico has been drying up at very high rates. And the temperatures in parts and counties of New Mexico have increased significantly over the last many decades, as have many places all over the world. And you've probably read about the fact that through increased carbon emissions and global warming, our planet is heating up at rapid rates since the post-industrial revolution. So I got involved in climate change because of the extreme heat, the drying up of the river that I can see outside of my house, and the fact that my kids are growing up and I know that they're wanting to have kids, and I want to be around for their kids, and I want our planet to be a safe place for, after I pass on. I'm going to stop right here and talk a little bit about the Climate Change Echo program. I want to tell you about that climate change is a public health emergency with real and dramatic implications for human health. This is an all hands on deck situation for clinicians who are increasingly managing patients with health problems related to climate change. And these include kidney failure and heat stroke from exposure to extreme heat and drought, as well as cardiovascular events brought on by air pollution and wildfire, as well as mental health problems such as anxiety and existential stress, especially seen in our youth and young people. Yet relatively few health professionals know how to engage patients on these topics. In a recent global survey of over 4,600 health professionals regarding climate change, 76% recognize the need for continuing professional education. 72% desired knowledge regarding healthcare sustainability, and 69% responded that effective communication skills are also needed. Immediate engagement and effective healthcare and public health responses are called for to reduce climate-driven effects on human health and well-being. Meeting this need will require clinicians to quickly acquire the knowledge and skills to address climate change effects in their practice. Efforts are underway to remedy this educational gap, particularly in health professional schools, but there remains much more to do. And in the past 2 to 3 years, we've seen some education come to medical schools and nursing schools, but not nearly enough. In addition to managing climate-related health issues, clinicians find it difficult to talk with their patients about climate change, which is at the center of significant socio-political controversy, misinformation, disinformation campaigns, and a complex psychology of denial. Therefore, clinicians might be uncertain how to talk to their patients or approach this issue with them. They typically receive insufficient training on how to have challenging conversation with patients in general. And these include topics such as gun safety, suicidality, domestic violence, sexual health, and so on. And climate change is just one of these other emotionally laden topics. However, clinicians' status as trusted messengers allows them to shift social norms and communicate the potential health effects of climate change. And so we must use the fact that clinicians are trusted messengers when it comes to climate change information. Did you know that clinicians are more trusted than scientists, than than the people you watch on the news, than celebrities, than politicians? It's your primary care provider. It's the clinician that you go to when you have a problem. They're the real trusted source for information when it comes to these emotionally laden topics. So our climate change and human health echo that I talked to you briefly about is a weekly virtual telementoring program for healthcare and public health professionals addressing essential climate and health educational needs for clinicians. The program has 3 objectives. The first is to increase knowledge and confidence, or we call it self-efficacy of climate change. We want to teach clinicians information, and we want to improve their confidence about what they know. We also, secondarily, we want to improve their communication skills, not only clinicians, but community health workers and other educators. And the third objective is to advance knowledge on environmental justice and health equity to reduce health disparities. The Climate Echo program launched a pilot program in February of 2021 when we first started, with input from the U.S. Global Change Research Program's Climate Change and Human Health Interagency Working Group. Project Echo has learners from more than 190 countries and builds virtual communities of practice where peer participants meet regularly to learn from subject matter experts and from each other, freely sharing knowledge, support, and guidance. The initial February 2021 8-week introductory pilot series drew 625 participants from 45 of the United States and 25 countries. Most participants were health professionals, including physicians, nurses, and behavioral health providers, and they expressed high levels of satisfaction with the program, reporting that it increased their climate-related knowledge and communication skills. Other sessions have included theme-based topics featuring experts in their field. We even had professional actors working with us to simulate patients suffering from climate-related health effects to help participants better understand how to manage real-life climate-sensitive health concerns. These are all the different series we've had. Each series have lasted 4 to 8 weeks. Every session is 1 hour long, usually on a Wednesday at 12 noon Mountain Time. So we've gone from having an 8-week session on climate change essentials right in the middle of COVID, going to having a topic on extreme heat, and then to mental health and climate change, and then talking about environmental stewardship and poor air quality. And the clinicians, like I said, are coming from all over the United States. We now have clinicians coming from all 50 states. And the average number of participants ranges from about 75 to 150 participants on the Zoom network. Most of the people have their cameras on, so it's a real kind of community of practice. They're sharing their knowledge, they're putting information into the chat, and then after a typical didactic session, we have lots of questions and answers. And we have case-based learning, meaning that we'll present a case. So here's a typical case. We might talk about a scenario involving a 45-year-old mail carrier, a postal worker who had suffered a heat stroke, or another scenario focusing on a 45-year-old woman with a history of asthma, depression, anxiety, and insomnia, who's lived in a wildfire region. And these sessions are wide-ranging, including how to reduce greenhouse gas emissions for the health sector. Other discussions are more clinical, such as the challenges of determining optimal interventions for complex problems. For example, what's the right advice to give a 68-year-old person with lung disease who walks outside daily for exercise when the air quality index is poor for an extended period. There's a trade-off to telling a patient to stay indoors during this time. The benefits to exercise are important. The value of social connections from being out in the community are also important. And the specifics of the home environment must also be considered. But going outside could be dangerous if the air quality is so poor. Often for complex problems, there's many trade-offs, and there's a no one-size-fits-all solution or clinical recommendation. And that's why these discussions on this climate echo are so important. So by participating in these echo sessions, clinicians can be better prepared to discuss the health impacts of climate change with patients. The call for and creation of additional content speaks to the flexibility of the echo learning model. As the science and clinical needs related to climate change and human health evolve, the echo model can keep pace, training clinicians quickly so they can immediately respond to their local and regional specific climate problems. The most recent session that we've had just finished yesterday and was called Climate Health is Community Health, which was a very important initiative for all health professionals and community health workers to understand about local health-related effects of climate change unique to their own communities. The ECHO All Teach, All Learn format builds a rich community of practice that enhances learning. After the session, participants say they are more likely to communicate about climate effects with colleagues and patients. This diffusion of knowledge promotes capacity building among health professionals, which is critical for addressing the climate and health emergency we face. The Climate Echo has grown to engage more than 6,000 unique participants from all 50 states and more than 45 countries. Now other programs, including Dartmouth-Hitchcock and the Migrant Clinicians Network, have begun their own Climate Echo programs in the United States. India, which reaches thousands of learners, has a Climate Echo program that has addressed water pollution and is also including mental health and sustainable agriculture. Climate change is among the most emergent and urgent health crises humanity faces today. By investing in forward-looking professionals equipped to manage their patients' climate health effects and to educate their patients on climate change and its implications, we can do a lot by educating healthcare professionals. I just read an article that was published that I wrote with my colleagues that was just published this month in Lancet Planetary Health, and I can chat in the reference. So thank you all so much. This is a link to our website. I can also chat in a link to our website, and please feel free to join us. We're taking a short hiatus this summer, but we'll regroup in the late summer. Thank you.
Preguntas, questions.
Hello. Thank you so much for your presentation. So it got me thinking a lot about something that I've been talking with some people, especially the young population, the youth. There's like a conception of the world is going to end. It's going to end soon if we don't do something about that. And the youth sometimes feels empowered, but not in the real way or in the way that can make like a significant change to that reality. So that takes a toll in our mental health, definitely, because we are thinking that we probably won't reach to a moment in our lives when we can see, for example, our grandsons or daughters grow. So yeah, it got me thinking about it, and thank you for sharing these resources, because I think it's necessary that clinicians and psychologists know about this specific topic, so they can handle some episodes of stress or anxiousness or mental health in general more appropriately, because I think that it's in the root sometimes of a lot of our mental health issues. So thank you.
Absolutely, absolutely. You basically hit the, tell me your name again.
It's Gonzalo.
Gonzalo. Oh, thank you so much. You really hit the nail on the head with your question. If anyone is gonna, the youth are really asking the best questions and are really doing the most in terms of advocating for the health of the planet and creating so many amazing solutions, and are carrying the weight on their shoulders with the most stress, you know, in terms of kind of mental health effects. I am very hopeful. I want to let you all know that I think there is so much hope, and I think that so many countries, so many organizations, so many people are, so many community-based organizations are doing so much, and there are so many nature-based solutions right now to the climate crisis. The planting of the tree, so many urban gardens, trees are being planted. So many solutions in terms of different kinds of plants putting up against to minimize sea walls, to minimize sea level rise. There's a lot of research being done regarding carbon capture as well. So I think that there's just a lot to be hopeful for, and we can never lose sight of that. And I think it's really, I think when you start to feel kind of a little bit nervous or anxious about the future because of global warming, I think the more you can kind of do something, kind of advocate for it, do something, kind of get active. I think studies have really shown it can be really also helpful for you, or get involved in an organization. But if you look into kind of nature-based solutions, there's a real lot going on about climate health. And the United States and the United Kingdom in particular, England, is making great strides in sustainability. So thank you for that great question.
Just prompted by Gonzalo's question, how prevalent is the youth concern about the future in the studies and the work that you're doing? How much of the mental health challenge post-COVID is related to climate change or views about the future? Just, you know, what are statistics around that?
Yeah, I mean, I think that there definitely, you know, I mean, youth mental health concerns. I think that there is definitely existential climate concerns in the youth is definitely significant. I'm not a psychiatrist. I've read some information. I think it's I don't know if it's double digits in terms of what percentage of the population of youth that are experiencing kind of anxiety. It's much more on the anxiety spectrum than on like a depression spectrum. So this is not related to suicide. It's much more related to youth that are anxious, that are not wanting to have kids, that are not wanting to increase their carbon footprint as they move on in the world. So that are experiencing.
I ask it because we're having a peace engineering conference, and a partial antidote to hopelessness is what can I do?
Exactly. That's
and you pointed to that, and
yes, absolutely. No, it's a great
about organizing the
yes
around what can be done.
Exactly. There, I can I can get you some names of some youth groups.
Thank you. Thanks. Dr.
Absolutely.
Hello, Professor Kaufman. My name's Norm Gom. I'm facilitating the Middle Rio Grande case study for the Argentine scholars, and it's been a very interesting experience. I would like to get a copy of your slide showing the re-wetting of the dry Rio Grande near Corrales. I presume that's where that was. And I would just note for the class that the Rio Grande in Albuquerque went dry for the first time in 40 years last summer, a very dry summer. My question for you, Dr. Kaufman, is, you mentioned your interest in water, and what we need to build is community interest in solutions to our water crisis to prevent a tragedy of the commons. Would you know how to engage with the people who are striving to get this word out if you were so interested? And what would you suggest?
Thank you. I've worked a little bit with the folks from South Campus, the folks that are working with the school, the folks from biology, and I'm just trying to think of their big group, their big large NSF grant. I've worked a little bit and spoken to them a little bit, but I haven't done a lot in terms of kind of water in New Mexico. I've done more, I'm kind of new to this myself. I've done much more in terms of like health professional, education. So I can't speak directly to the water issue. I can speak directly to kind of key stakeholder relationships and the success that it takes to get initiatives working and people working together. And what I could say is I would build alliances with people across the university. I know there's a team. I think it's the Mark. I'm just forgetting his name, and he just moved to Wyoming. It's
Mark Stone.
yeah, with Mark Stone's group. They're doing. I would get involved with their group. I would get involved with the state's water folks, and get meetings together. But I'm a big believer that getting key stakeholders together to have meetings and talk about who's affected and who are the most vulnerable, and trying to get to the local state representatives and state senators and talking about the issues and kind of being the squeaky wheel and never kind of stopping at that. That's how I've had success when it's come to pain and opioid legislation. That's how I would suggest moving forward with this.
Thank you.
Thank you.
So, hi, Dr. Katzman. My name's Donna Keckner, and I'm working with ECHO to do peace engineering ECHO as well. So our group is doing this. And I just wanted to let the students know that, so it doesn't have to be medical. It can be any sort of thing. We're working in Sudan with garbage collection and recycling. And so I believe, and you probably have a better idea than I do about the hubs in South America, but ECHOs are in many universities, so you wouldn't have to start on your own. If you're working with a university or with a medical complex, there's a huge support network for doing this type of thing to bring learning and enabling communities to solve their own problems. You're teaching the professionals, just like Joanna said, she's teaching healthcare professionals how to talk about climate change. And so it's another resource that you could have if you want to have a structured network that is that helps you reach out to communities. Anything else you want to say, Romero?
Yeah. So. This, I think, let me add a couple of things. There, we started saying that anything can be weaponized, right? A pencil, all that. So COVID was something bad. But what, do you have anything, do you think COVID did something good, brought something good for us?
Yes.
So what happened with COVID, it made us rethink of all the networks that exist, right? Is the education network working? It failed. The health system, was it working globally? It failed. Supply chains, it failed. Transportation. So it made us rethink, and this is why we're addressing all these issues at the same time. When we organized the conference, we invited the Sanjeev Arora, who created ECHO, to the conference. He gave a keynote talk and announced the importance of ECHO. And what ECHO has done is democratize the knowledge of healthcare taken from the experts, which are in Albuquerque, the hospital, take that expertise to remote areas and treat with the same quality in patients. And that was a groundbreaking paper published, and that made ECHO go global. They treated one disease, now they're treating over 80 diseases that can be treated. We're not talking research. That network has expanded to every medical school in the US. World Health Organization uses CDC. They have trained, because of COVID, they were able to train like 15,000 nurses and first care in a week or 10 days. Okay. Congress gave ECHO funding to train people in the US to protect COVID. All the medical schools, many in the US are connected to ECHO. And at the same time, ECHO now is in 148 countries. In Argentina, there's 4 ECHOs. The big hub in South America is Universidad de la República in Uruguay. So healthcare. We jumped in because for healthcare providers to treat, they need infrastructure. So the basic infrastructure is what? Water. Do you need energy? Do you think you need energy to do healthcare?
Yeah.
Do you think you need telecommunications?
Yes.
Everybody needs a cell phone. So that was the urgency of what we reacted, and Donna manages that. We had a problem, like say Nigeria, because of COVID, 80 million people could not attend education, 80 million. No electricity, they couldn't go to online. No telecommunications, they had to stay at home. So how do you address that problem? Peace engineering. So with healthcare, like education, you need to build infrastructure. So we're talking roads, water, and all of that. So this is how we, peace engineering with ECHO, are working together globally. Donna mentioned Sudan. Waste management. But in Sudan, ECHO created what they call community medical response teams, first responders to go fast and treat people. We help by creating community engineering response teams. Why? We need to deliver the water, the energy, telecom, so doctors can come in and do their thing. So this is how we breaking barriers and working together. Very important is policy. There's no policy. Right? Sudan generates more waste than they can collect. There's no policy, no finance. So these are the problems. These are real life problems that we're trying to address. It's not just your textbook thing. I just want to say that so you understand the dimensions of just ECHO, the health sciences, with the peace engineering thing that we provide. So we all have to work together. Thank you.
Great. Well, thank you so much. These are an excellent example of intersectorial collaboration for health. And, we'll invite you to all to bring, or connect to the ECHO network and stay connected that way through UNM. So thank you so much, Joanna. Thank you for your time and for your leadership. Take care.